Welcome to Drugs Decode. Today, we're diving into clinical pharmacology, specifically the cardiovascular system. I'll ask a question, pause this video to think, then break down the correct answer and why the other choices are incorrect. Let's get started. Question 1. Which of the following is the first-line treatment for hypertension in a patient with chronic kidney disease, CKD? Correct answer is B, ACE inhibitors. ACE inhibitors are preferred because they lower glomerular pressure and reduce protein loss in urine, thereby protecting the kidneys from further damage. Let's see other choices. Thiazide diuretics, effective in mild hypertension, but lose efficacy in advanced CKD. Beta blockers, used if there's heart failure or arrhythmia but not first-line for CKD-related hypertension. Calcium channel blockers, effective at lowering BP but do not protect the kidneys as well as ACE inhibitors. Question 2. Which drug is most commonly used for acute management of supraventricular tachycardia? Correct answer is C, adenosine. Adenosine temporarily blocks AV node conduction, stopping the abnormal rhythm and restoring normal heart rate within seconds. It's given as a rapid IV push. Let's look other answers. Atropine, increases heart rate, used in bradycardia, not tachycardia. Amiodarone, a strong antiarrhythmic but used for ventricular arrhythmias or atrial fibrillation, not SVT. Digoxin, slows heart rate but is not fast-acting like adenosine. Question 3. Which antihypertensive medication is contraindicated in pregnancy? Correct answer is C, ACE inhibitors. ACE inhibitors cause fetal kidney damage, oligohydramnios, and congenital malformations, making them unsafe in pregnancy. Question 4. Which class of drugs is most effective in reducing LDL cholesterol levels? Correct answer is B, statins. Statins inhibit HMG-CoA reductase, reducing cholesterol synthesis and lowering LDL significantly. Let's look other answers. Fibrates, lower triglycerides, not LDL. Bile acid sequestrants, lower LDL but less effective than statins. Nicotinic acid, niacin, mainly raises HDL rather than lowering LDL. Question 5. Which anticoagulant requires monitoring of INR, international normalized ratio? Correct answer is C, warfarin. Warfarin works by inhibiting vitamin K-dependent clotting factors, requiring INR monitoring to ensure safe blood thinning. Question 6. Which of the following drugs is a selective beta-1 blocker? Correct answer is C, metoprolol. Metoprolol selectively blocks beta-1 receptors in the heart, reducing heart rate and myocardial oxygen demand without significantly affecting beta-2 receptors in the lungs. This makes it safer in patients with asthma or COPD. Let's look other answers. Propranolol, non-selective, blocks both beta-1, heart, and beta-2, lungs, which can worsen asthma. Carvedilol blocks beta-1, beta-2, and alpha-1, making it non-selective but useful in heart failure. Labetalol, non-selective beta blocker with alpha-1 blocking effects, used in hypertensive emergencies. Question 7. Which drug is the first-line treatment for acute heart failure with pulmonary edema? Correct answer is B, furosemide. Furosemide, a loop diuretic, quickly removes excess fluid by increasing urine output, reducing pulmonary congestion and improving oxygenation. Let's see other answers. Digoxin, slows heart rate and improves contractility, but does not provide immediate relief in acute pulmonary edema. Spironolactone, a potassium-sparing diuretic used for chronic heart failure, not acute cases. Metoprolol, beta blockers are avoided in acute heart failure because they can worsen symptoms. Question 8. Which drug is the most appropriate initial treatment for stable angina? Correct answer is B, nitroglycerin. Nitroglycerin, a nitrate, dilates coronary arteries and veins, reducing myocardial oxygen demand and relieving chest pain within minutes. Let's see other answers. Nifedipine, a calcium channel blocker, but not first-line for acute angina relief. Digoxin, used for heart failure and atrial fibrillation, not angina. Amiodarone, an antiarrhythmic, not useful for angina. Question 9. Which of the following is an aldosterone antagonist used in heart failure? Correct answer is A, spironolactone. Spironolactone blocks aldosterone receptors, reducing fluid overload and improving survival in heart failure patients. Let's see other answers. Furosemide, a loop diuretic that removes excess fluid but does not block aldosterone. Hydrochlorothiazide, a thiazide diuretic used for hypertension, not heart failure management. Mannitol, an osmotic diuretic used in cerebral edema, not heart failure. Question 10. Which of the following drugs should be avoided in patients with heart failure with reduced ejection fraction? Correct answer is C. Verapamil. Verapamil, a non-dihydropyridine calcium channel blocker, reduces heart contractility, making heart failure worse. It should be avoided. Let's see other answers. Bisoprolol, a beta blocker that improves survival in heart failure. Enalapril, an ACE inhibitor, essential for reducing heart failure mortality. Spironolactone, aldosterone antagonist that helps reduce fluid overload. That's it for today. I hope you enjoyed this clinical pharmacology cardiovascular quiz. If you found it useful, hit that like button, subscribe, and comment below for more quizzes. See you next time on Drugs Decode.